And to health matters, the percentage of deaths, especially amongst children due to malnutrition, have increased from 5 to 20%. This number by the Medicine Sans Frontiers (MSF) represents a dire situation born out from conflict zones and countries affected by endemic diseases. In a media parley with journalists in Abuja, Dr. Christos Christou, the international president for Doctors Without Borders, advocated adequate access to medicine and vaccines to mitigate cholera, malnutrition, and malaria. Here's more on this report.
Doctors Without Borders accredited the increase of malnutrition to the rampaging flood cases and other natural disasters in communities. Dr. Christou noted that 12,500 cases of measles have been treated between January to August this year.
This gets free access to a good quality of care and all the medicine. But this has to do with our MSF projects. Okay, this is our mandate, this is our supporters ask from us to do, and this is what we do. But if you look at the budgets, and if you look at how we try to impartially assess the needs everywhere around the world, although Nigeria seems to be one of the places where we allocate a quite big amount of our resources, we are still just a very little drop in the ocean of the needs. What we do is to show a good quality of care and how this can be also replicable by others. But we cannot, and I wish we could, go and reach every single person that is in need.
Dr. Simba Tirima, country representative for MSF in Nigeria, noted that although the Nigerian government is prioritizing preventable measures instead of vaccines, its mission is to collaborate with authorities, including the Ministry of Health, to prevent death.
What we believe, and Dr. Christos also said this, if there is commitment to address malnutrition in this country, at least that the part where it becomes a disease that needs to be treated and managed in a hospital setting, right? It is possible. What to do that? We believe that this country can do it. We actually receive these children at their almost last stage. That's when, you know, and so it's when it becomes a clinical problem. This is sometimes when we get in. Of course, we are also doing outpatient treatment.
Heads of mission Ahmed Bilal and Abdullahi Ali noted that the northern part of Nigeria accounts for the highest number of admissions of malnutrition. They added that the number of admissions increased by over 50%.
We were putting 2 patients on one bed, and this is really a concern where we see that increase by over 50% if we take both ITFC and ATFC. And of course there could be many reasons linked to that. We may be not going on those reasons, but the increase is there, and this is alarming concern. The increase overall in Nigeria, but particularly in the north of the country. We have huge increase of malnutrition.
And in remote settlements, we also modernized decentralized kind of healthcare, where we train community volunteers. We identified by the Ministry of Health and the community leaders in the remote locations. For example, where we work in Zamfara and in Sokoto, so that those community workers come to us in the LDA headquarters. We train them, we give them free medicines, and they take back to the community and they treat the patients.
Borno State, among other states in Nigeria, is facing an unprecedented flooding caused by the overflowing of Alau Dam. The flood inundated entire communities, destroyed crucial infrastructure, and forced more than 400,000 people from their homes. At least 30 people have lost their lives as a result of the floods, and the death toll is expected to rise as many areas remain inaccessible. But the mission said it will continue to monitor the situation while providing response in their capacity.